Hello everybody, my name is Dr. Nandita Rai and I'm a cosmetic dermatologist, and today my topic was PRP and PRF. I'm so sorry today, actually I cannot come with my usual face because I am actually traveling and I had some duties to attend, so that's why I could not come on time at 7 p.m. But I apologize and I'm really sorry I could not come at 7 p.m. But still, it's right now 7:15 p.m. 15 minutes late, so I'm still managing to come live today on the topic PRP, platelet rich plasma, and PRF, platelet rich fibrin. Why I'm talking about this topic is it's new revolutionary cosmetic treatment in the field of dermatology for skin rejuvenation and for hair growth. It definitely helps in skin anti-aging, like wrinkles, like sagging, and it also helps in treatment of like acne scars, sometimes burn scars, and healing of unhealed wounds. So that's why PRP and PRF we use in cosmetic dermatology. It's a revolutionary modern medicine which doesn't come into drugs category. It comes into aesthetic medicine. Aesthetic medicine is traditional medicine which we use in medicine nowadays, and it was first used in orthopedics department to heal the inflammation between the bones, like arthritis, tendinitis, synovitis in the sportsmen and women, to treat and heal their muscle injury, cartilage injury. So it was used there, and with the scientific progress of this aesthetic medicine called PRP and PRF, started the treatment in field of dermatology, because it was related with tissues, cell structures. Therefore, in dermatology, lot of academic dermatologists, scientists started using to heal the skin, and also started using in the hair growth, because it definitely targets the cells in the skin. It targets the cells and the hair. That's why it leads to rejuvenation with very minimal side effect. So definitely it is a wonder medicine. It's a miracle medicine, and it doesn't come into drugs. It is aesthetic medicine, purely natural aesthetic therapy treatment for skin and hair. Now if you ask me actually what is PRP and what is PRF and why there's a difference, the difference is basically it's withdrawn. These are from blood of your own body. Patients who come for hair loss treatment, or wrinkles, sagging, acne scars, or burn marks, or burn scars, or non-healed wounds, serious injuries. So these are used that time, and definitely it is working, and it is very effective, and it has no side effect. The side effect definitely comes if you are having cardiovascular diseases like thromboemboli, pulmonary diseases, heart problems, like cardiac problems, like if you're having ischemic heart diseases, deep venous thrombosis, and other cardiovascular diseases, then we try to avoid, because it's important to avoid in such patients this kind of treatment called platelet rich plasma and platelet rich fibrin. And we derive from one's body, we withdraw the blood, whole blood, and we centrifuge in the machine, and we withdraw plasma, which is the upper layer of the blood. So after rotating it for 3 to 8 minutes under 1300 RMP in centrifuge machine, we derive upper layer that is called plasma rich platelet, which is also one of the miracle therapy for hair loss, skin rejuvenation, skin treatments. a lot of skin treatments. And the middle layer between the RBC, red blood cells, and the plasma, the middle part is fibrin, which is very, very good because it consists of leukocytes, it consists of growth factors. So these both platelet rich plasma and platelet rich fibrin, both components of the whole blood, are very good for sagging, sagging any part of the body. Like if you, for example, being a doctor, if you ask me what kind of cosmetic treatment for sagging, if you ask me, it is sagging of your face, sagging of your chest, axillary part, breast, or sagging of your buttocks. And also it is nowadays used in gynecological cosmetic treatments like vaginal tightening, erectile dysfunction. So these injections with whole blood platelet rich plasma, derived from whole blood platelet rich plasma and platelet rich fibrin, are used for vaginal rejuvenation and erectile dysfunction and other parts, sagging, wrinkles, for glow, for toning, for acne scars, burn scars, and definitely it will rejuvenate your skin, and it will give you a lot of difference in your body, and it is very good for skin. And also hair loss. So in hair loss, it targets the cell, and it has got a lot of growth factors, like insulin growth factors, vasoendothelial growth factors. It has got a lot of keratinocytes, growth factors. That's why it targets the hair cells and leads to hair growth. Patients who are having hair transplant, they come to me for sessions of PRP and PRF, and they have got wonderful results post PRP and PRF, even if they have done hair transplant surgery. Because hair transplant surgery is like, it needs time to heal. You are undergoing some electric device to extract your hair, follicle extract unit and follicular, transplant unit. Foot and few, which we call it, in a short form. So this all needs healing, and to heal, the best option for cosmetic treatment in dermatology is PRP and PRF, which leads to wound healing, and also it leads to cells nutrition in the hair and leads to hair growth. And it's both for hair and skin, total body. It was used in orthopedics department, as I told you in the introduction, that it came from orthopedics department because they used to treat a lot of muscle injury, cartilage injury in the sportsmen and women. And then it started into dental clinics, for in the dental implant, they use this PRP for their teeth, gums problem. So in the department it is used, so dentist knows better what I'm talking about. And also it is being used in gynecology for vaginal tightening and erectile dysfunction. And definitely it is a wonderful aesthetic, I will call it aesthetic treatment, because it doesn't come under drugs department, and FDA, it's not under FDA, because the machines definitely are FDA approved, but definitely this is not under medicine. It comes under aesthetic, totally aesthetic medicine, and it has got no side effects until and unless you suffer from cardiovascular diseases, like heart attack, or you had heart attack, or you had deep venous thrombosis, you had ischemic heart diseases. So therefore we don't use on those kind of patients who are having lung or heart problems, or cancer patients. We don't use on them. Like chronic illness, we don't use them. Only recommendations are there, like for diabetic patients, if they have got some kind of unhealed wounds, we can use them in diabetic patient, but under the control of their blood sugar level. Even in thyroid patients, when they are having some skin problem, we can use them under the control of their hormonal evaluation in the lab test. And they should take the medications, of course, and they should continue using their prescribed medicine from their respective doctors, and they can use it for non-healing wounds. And hello whoever have joined, thank you so much for listening to this live chat. And if you have questions, you can ask me, I can answer them. So this is the thing. So definitely, if I summarize, I will again repeat it. for the people who are joining right now, that I'm actually sorry that I could not come face to face, but I'm driving my car, and I had to attend some duties, so I am coming back to home. And definitely I was eager to discuss about this topic, because it's very good topic: modern medicine, modern therapy, aesthetic medicine, so definitely today I'm driving and I'm talking like crazy person, but I like to inform my patients, my friends, my colleagues, about the treatment that we are doing in neoskinclinic Siliguri. And it's the only skin clinic where PRF is done for hair growth and skin treatments, and it works, because a lot of acne patients, acne scar patients, burn patients got benefited by this treatment. And this is the most versatile treatment that I have ever seen, and it definitely gives results. And according to the patient's body, according to their history of illness, I prescribe them and I recommend the treatment. I do my two treatments to all my patients accordingly to their history and their requirements, so there's indication for it. Side effect, I might say that it gives you blood clot, it can give you some kind of swelling, pain, some kind of allergic reaction can come, but it is very minor and it can be treated until and unless it's not contraindicated in your body. We don't use on the contraindicated patients, we use only in the patients who require it. Therefore side effect is very, very, very less, and I've only seen some swelling or pain or tenderness. I've just seen some kind of rash, but those are already treatable, and they have already been treated many times. And the benefit is definitely 100% benefit is there. You get the benefit, you can see the result. And if you ask me, when can we see the real result of PRP or PRF, platelet rich plasma and platelet rich fibrin treatments in dermatology, I can say that you have to wait for 3 months, and in between you can do two sessions at least, and maximum sessions is 4 or 5 but in a year. But within 2 sessions you can see real result. And if you need more complete result, it depends, according to the improvement. I will see the patient, I will monitor the patient, and if they really need it, then I do the 3rd and 4th session. Otherwise, within 2 sessions in 3 months, you definitely get good results, and no need to worry. And for maintenance, you can use for skin moisturizer, sunscreen, and other ointments, which I like to indicate when I see the patients, accordingly. And for hair loss, I definitely give them hair serums, solutions, shampoos, post-treatment care is one of the most important part to get complete benefit. So post care must be very well done. It must be taken care of, and should follow the prescription accordingly, according to how I prescribe. And a lot of other dermatologists or cosmetic surgeons, they prescribe you have to follow those post care treatments. And always keep in touch with doctor. Do not hesitate to connect with doctor, and tell all your progress or whatever side effects you're facing. You must not hesitate. And definitely these are the 2 treatments which I give to my patient, and it is definitely, once more I repeat, it is for wrinkles, it is for glow, tone, acne scars, birthmarks, burn scars, non-healing wounds. It is for hair loss, it is for vaginal tightening and erectile dysfunction. And this is the most unique treatment that is available only in neoskinclinic Siliguri. And if anybody has question, you can ask me. You can actually inbox me, or maybe you can just comment. And definitely I will be answering them, and you can call 70700 for further details and appointments. So it was good, that I'm driving and I'm talking live on this, Instagram. It's a good opportunity to get informed, to give information, to connect with patients, colleagues, and a lot of people. And thank you, whoever have joined, and thank you so much. I'm so happy that I'm able to do all this, live chat. Even there are challenges, and I hope the Sunday was good for all of you. Have a great Sunday, have a great friendship day. Cherish your friendship with your family, with your friends, with close people whom you share the bond, and always stay happy, healthy, and always pray that we will overcome this pandemic situation, and maintain social distancing, wear mask, stay hygienic. That's it. Good night and have a great sleep. Thank you.